In today's video, you're going to learn one of our favorite unique exercises that works 7 important elements to moving freely and without pain. So whether you've got pain of the SI joint, the anterior hip, the knees, or you want to improve your hamstring length or glute activation, check out this exercise. Coach E for Precision Movement here, and today I'm going to walk you through one of our favorite functional integration techniques for the lower body that works many different important elements to a lifetime of moving freely and without pain. And if you're more of a beginner or you're new here to our channel, then you might find some of this, you might feel like some of this is going over your head and it's too much, and maybe I'm using terms that you don't understand. But what I suggest is you just stick with me, do your best, and then I'm gonna show you other resources and give you other resources to isolate certain elements of this one technique so that you can learn those and then you can come back and add them in. But do what you can, do your best. And if you just do your best and you get maybe 50% of the way there, you're gonna significantly benefit from this exercise. The technique is called the hinged knee flex. And again, it's one of my favorite for SI joint pain, knee pain, improving hamstring length, and even femoral acetabular impingement or anterior hip pain. For the exercise, you set up shoulder width apart, feet are pointing straight ahead. Get yourself in a good, relaxed posture to start. And the first thing you're gonna do is go from the ground up. We're gonna activate the intrinsic foot muscles. So that short and skinny foot, and you're creating that active arch. So your muscles are creating the arch. You don't wanna be gripping and flexing the toes too much. You wanna think of pulling the metatarsals, the forefoot, towards the heel. Now again, like I said, there might be some stuff in here that you don't understand. If you don't, we'll link to it below, but just do your best as we go. So now I've got my feet on. Next up, pelvic floor. So you pretend that you're peeing and then you stop pee midstream. That's the pelvic floor. And those muscles, we want those on. So we've got the feet on, the pelvic floor on. Next up, we layer on top of that glute activation. Once you've got the glute activation in, the amount of activation, 50% to 70% to 100%, you could do it max out. But if you can get to 50%, that's great. So now, just by doing this, you should feel pretty stable. From here, what we're gonna do is a hip hinge movement. So a hip hinge is maintaining neutral spine, so the spine doesn't move, we're just hinging at the hips. Now the knees, they can bend softly. We're hinging, but we're keeping that activation. Now here, I wanna make sure the glutes are on. I also wanna think about maintaining my anterior pelvic tilt. I get down into this position, I'm in neutral spine, but relaxed. Feet are on, pelvic floor is on, glutes are on. And then I'm gonna activate the quads to fully straighten the knee, try my best to keep everything else on. Hold it for 2 seconds. That's lengthening the hamstrings and activating the quads. And then under control, return to the start position, and then do the other side, consciously activating the quads. You can tap it, especially the VMO, the medial aspect here. Tap it. Hold it for 2 seconds, control it on the way down, and then maintaining activation of everything we started with. We're coming back up to neutral or the start position, and then gradually letting everything go. I'm gonna do that again. This time I'm gonna show you with the hockey stick here to help you with some feedback on your alignment, your postural alignment. So here, we wanna hold the stick and maintain just a little bit of pressure between the stick and the hand. So there's not too much space like that, excessive anterior tilt, and you've got 3 points of contact. You're not posteriorly tilted or you're not flexed through the lumbar spine. So I've got a good neutral posture, and the first thing I'm doing here is feet. Activate those intrinsic foot muscles, and then floor, pelvic floor. Then I get glutes, layer that on top. And when I hinge over, I want to think of using my psoas, activating the front of the hip muscles here to pull me down into the hinged position. My knees are soft, and I'm maintaining 3 points of contact, tailbone between my shoulder blades and my head. Get to the end range, I could feel the hamstrings tense. I maintain activation of everything. And then I activate the quads, straighten the knee, hold it for 2 seconds, breathe. And then other side, straighten the knee, hold it for 2 seconds, breathe. Return slowly and under control, maintaining activation, or if you lose activation, get it back. And then my hinge back up, and then I gradually let everything go. So that right there is the hinged knee flex. And I walked you through it pretty quickly, but there are a lot of elements there, and there are a lot of key elements there. I just wanted to take a really quick minute to share a message with all the motivated personal trainers, yoga instructors, massage therapists, physios, and even doctors that I know watch our content. As you've seen, this technique gets deep, and this isn't something that I would teach somebody right off the bat, but eventually people need to learn exercises like this. They also need guidance on when to get to exercise like this and how to progress up to it. So if you understand how going deep with a technique like this at the right time and how to progress up to it is important for helping people get out of pain, especially when other attempts have failed, then I'd like to invite you to learn more about our upcoming Certified Precision Movement Coach course. This course will set you apart as an expert in corrective exercise versus somebody who hands their client a sheet of stickman stretches. As of this video, we are in the final stages of wrapping the content up. So if you're watching today's video fresh, click the link below to get on the wait list. Or if you're coming here after a little bit, then if you click that same link, you will see the course and what it's all about. Now, back to the video. For this exercise, you want to do typically anywhere from 2 to 3 sets of 4 to 6 repetitions per side. And you can even go lower. If you're really going slowly and ensuring you've got activation, you're performing all of the different elements that I outlined here, then maybe you're doing 2 to 3 repetitions per set. Quality over quantity. Now, as you can see, we went through a lot there. So let's do a quick recap of the different elements and how important they are for you. Number 1, intrinsic foot muscle activation. If your feet aren't working well, then that very first interaction between your body and the ground is dysfunctional. And the forces that should be absorbed through the feet have to go up the chain. So it could go through your knees, could go through your hips, could go through your lumbar spine and your pelvis. Don't know which area it's going to go through, but it's got to go through somewhere. So we've got to get the feet working well. Number 2, integrating the pelvic floor activation. That is the deepest muscle group in through the pelvis that provides that stability for the pelvis. So if you've got SI joint pain, this is a really, really important element to improve and work on. Number 3, we've got our glutes. You hear about the glutes all the time. This exercise activates them with the deeper muscles, the pelvic floor muscles, and with the feet going through this fundamental movement pattern of the hip hinge, which is another key element. Another one, we've got psoas activation. You're not just hinging over, but you're actively pulling yourself into this position, maintaining that lumbo-pelvic alignment, and that requires the psoas to be on, and the psoas is another muscle that's often sleepy in people and is important for SI joint pain, which I mentioned earlier, as well as femoroacetabular impingement, or FAI, which I mentioned earlier. That muscle helps you to maintain what we call centration of the head of the femur. This is your thigh bone, and it's got a ball on the end in the socket. This is your pelvis, on your pelvis. So it helps you to maintain that centration as you're moving around. Next up, we've got dynamic spinal alignment. So maintaining neutral spine in this fundamental movement pattern. Your control, your kinesthetic awareness, your ability to maintain that and be aware of it. Another key element, quad activation, especially the VMO. I tapped it for a reason because it's often sleepy, so you want to wake it up. By tapping it, you can feel it, and that increases the sensory input into your brain and tells your brain, hey, this muscle exists, let's use it. And by straightening out the knee, we're training something that's really important to keep your knees healthy and to prevent premature arthritis, which is terminal knee extension. If you can't fully straighten your knee, you're not properly loading your knee joint, and that's going to increase the wear and tear on the cartilage and break down that tissue early. So you might get into arthritis, or you might get into having to get a knee replacement earlier than you should have, or even a knee replacement when you wouldn't need one if you just maintain this really important ability to fully extend your knee and to keep it stable. And the last important element I'll talk about here is hamstring length. How often do people complain about tight hamstrings? I hear it all the time. When you're in this hinged position, you're already lengthening the hamstrings, and then we're getting that little bit more of active lengthening through the hamstrings because we're actively straightening the knee using the quadriceps, and we're lengthening and helping to maintain that hamstring length that we get because we're doing it actively. So those are all of the different elements that really make this exercise an important one to learn and to put into your toolbox to move freely and without pain for the long term. Thank you for watching. I really, really hope you take this exercise and start to do it regularly. Even 1 or 2 reps every day is going to benefit you greatly. Now, I promised that I'd link some resources. So what we're gonna do is we've got a couple right here, a couple videos right here of things that I talked about, and there are gonna be more in the description. The highest recommendation I have for you in this video is to start doing the daily movement tune-up inside our ROM Coach mobile app. Just get it, start doing it. Every day you'll get 3 new exercises. It takes 3 to 5 minutes, and you'll have mobilized every joint in your body and woken up every muscle in your body after 1 to 2 weeks. So get that and start doing it right now.